Hello and welcome back. In the first part of our video on zinc and the treatment of depression, we spent a little bit of time, just to recap real quick, looking at the information in the medical literature documenting some serious side effects showing up with pharmaceutical antidepressants, specifically the selective serotonin reuptake inhibitor class. And ironically enough, the side effects often involve increases in suicidal ideation and aggression, things that you would normally associate with worsening depression. And so we're looking at zinc as whether zinc has any use in depression, and we started in on the medical literature, not getting too far, but the first article we saw that we looked at was this zinc in anorexia nervosa, and that showed that those patients supplemented with zinc in the diet had improvements in their depression scores on a test for depression. The main weakness in this study is that they weren't specifically setting out to look at zinc in depression. And the reason that's important is that you're concerned with whether the improvement occurs by chance or is a product of the treatment. And so you can run statistical tests, as we talked about, and you say there's a p-value of less than 0.05 or 0.01. The cutoff for statistical significance is generally p less than 0.05, so a 5% chance that the results were not a random occurrence, a random way the deck got dealt out. However, if you look at 10 or 20 different endpoints, then that changes things entirely, because it's just like if you have a six-sided die and you're trying to roll two ones in a row. Well, there might be a 1 in 36 chance if you do that once. What if you do it 100 times? Eventually you're going to see two ones in a row. So likewise, if you're looking at lots of different things, some of them will pop statistically significant just because you've looked at so many things. So they didn't seem to look at a large number of things here. They were mainly concerned with depression and anxiety in the abstract, but nonetheless it wasn't declared as a study looking at depression. And then we looked at, where is it? It was a marker, here it is, that lower levels of zinc in the bloodstream are a marker for treatment resistance. And that, again, is very intriguing. However, in this case, it's not that they were giving zinc to see what would happen. It's that people with lower zinc were more likely to have a major depression that didn't respond to treatment. One thing you worry about with a finding like that is sort of a cart before the horse fallacy, that perhaps the lowered serum zinc is a compensatory mechanism the body is using to try to combat the illness. And so that would indicate both why it's hard to treat and why they have lower zinc, that your body's lowering zinc to try to correct the depression. So if you're not giving the drug and you're just looking at population-wise what's happening, you have to be careful not to fall into reading too much into what's going on. So now we can start in on more of the data. We're still only on page one, on the the first page. We're going backwards chronologically, and we'll get to the most recent study soon. But here is the first study that is a clinical trial. They're actually giving the zinc, and it's in depression, and they're seeing what would happen. This is a placebo-controlled study. So what do they say here? Growing body of evidence implicates derangement of zinc homeostasis and mood disorders. Okay? And this is in unipolar depression. That contrasts with bipolar depression, where people can be manic sometimes. And they're also noting that zinc levels are increased by effective antidepressant therapy, that they've seen that in previous studies. So this is a placebo-controlled double-blind pilot study. So this is the strongest study design that we know of. Pilot study means it's very small, and we see, so it was done in patients with major depression, and we see that it's only 6 patients receiving zinc and then 8 patients receiving a placebo, and this is a fairly modest dose of zinc, 25 milligrams once daily. All of the patients were treated with standard antidepressant therapies as well, because you don't want to just leave the major depression untreated. So the patients with placebo got placebo plus antidepressant therapy. These patients got antidepressant therapy and zinc. And then they used these 2 rating scales for depression. And they evaluated the effects, and what do we find? Zinc supplementation significantly reduced scores in both measures, this one and this one, after 6 and 12-week supplementation when compared with placebo. This study is the first to demonstrate the benefit of zinc supplementation in antidepressant therapy, and then they're talking about why this may be happening, and they have 2 theories there. So this one, we do have the full text available. We'll just kind of go through this a little bit. I'm not going to spend a great deal of time on it, but just talk about it a little bit. There's generally a standard format to writing these up. There's the summary or abstract, then the introduction giving sort of the context. So zinc is an essential bioelement, plays a wide range, fundamental role in a wide range of processes. It's a component of different proteins, modulator of the immune and nervous system. Here they're talking about preclinical studies. This is interesting, that in these preclinical studies they've seen alterations in brain zinc concentrations when treated both with antidepressants and electroconvulsive shock in rats. And so both of those led to changes in brain zinc concentration. And zinc exhibited antidepressant-like effects in animal test models of depression. So they've seen this effect preclinically. And that's what prompted them to investigate this in human unipolar depression. So then there's the materials and methods, and this is just a write-up that explains how you can replicate the study, because of course being able to repeat studies and see if you get the same thing is fundamental to science. And so it talks about what they had major depression, what they were receiving, when they were receiving it, 25 milligrams of zinc once a day, so on and so forth. The statistical tests that they used to analyze the result, in this case statistical test, the t-test. And then you talk about the results. And there's a couple things that I just want to mention here. Again, zinc supplementation significantly augmented the reduction in depression at the 6th and 12th week of treatment. And this was statistically significant. What's interesting is to look at the graph. What's interesting here is to look at the graph, and again, there are very few patients. So if we look at this graph, this is the Hamilton Depression Rating Scale, and the higher the number, the more depressed the person is presumed to be clinically. And then this is the weeks of treatment. So the first is when they just got antidepressant therapy. That's the solid line. And then the dotted line is zinc plus antidepressants. So if we're just eyeballing it here, the placebo plus antidepressants started about 22, 23, and dropped to maybe 15. The antidepressants plus zinc started at maybe 23 and dropped maybe 8, 7. Have to look through here to see what the specific numbers are. But just eyeballing it, the point I'm making is that you could have something that is statistically significant, but if what's called the effect size is very small, so in other words, you always see something, but zinc does 1/100th or 1/10 what the pharmaceutical antidepressants show on this Hamilton Depression Rating Scale, it wouldn't be all that useful. Now, we don't know what zinc would do if they weren't treated with antidepressants, because that would be considered unethical by the clinical review boards. But we can see that it seems to do almost as much as the antidepressant itself, or maybe more. And again, if this finding is not synergistic with the antidepressant, that would mean that zinc is twice as good as antidepressants. If they are synergistic, then it means that zinc seems to have about as much effect as just using an antidepressant alone. So in other words, if you just had the antidepressant, just the zinc, you would think maybe it would drop about like that. Or if the antidepressant is not doing anything to help the zinc, you would have this sort of a decline, which would be superior to the pharmaceutical antidepressant. And we don't know that because, again, it would be unethical to leave people untreated if you have something that you know works. And then this is and again, where are we? These were statistically significant findings. When you have statistical significance in a very small study, again, there were only 6 people that got this. That means that the effect size is large. So in other words, I don't want to draw this out too much, but if you have like a coin and you flip it 10 times and you get 4 heads and 6 tails, you might not say that's statistically significant. You'd have to run the numbers, but I don't think it would be. If you flipped it 10,000 times and you got 4,500 heads and 5,500 tails, you'd say, well, the coin is not balanced. But it would only be a very small effect, even though it was statistically significant. To see it with 10 people, you would need like 2 heads and 8 tails, or 3 heads and 7 tails. So when you have small numbers of people and there's statistical significance, that means that there's a big change going on. And that's what we see in this study. So you'd like to have a big study, but it's quite something that this 6 patients in the treatment arm and only 8 in the placebo, and they achieve statistical significance. This is with the Beck Depression Inventory, I think they called it. And again, here is your placebo going out over time to 12 weeks, and here is your zinc going out over time to 12 weeks. And by 6 and 12 weeks, there's a statistically significant difference between these 2 lines. Okay, so let's just discuss the discussion for a moment. The discussion is generally the last part of the study, where they talk about their findings and put it in context. And they're saying it indicates a benefit, zinc supplementation, for antidepressant therapy in unipolar depression. And again, they say although the effect is delayed, remember they were only giving 25 milligrams, so they weren't giving a large dose. Although if the effect is delayed, the potency is quite robust. So that's what I was just talking about. And they're mentioning this is consistent with preclinical evidence. What else do we have? They're talking about where was it? That imipramine induced a 20% increase in the ratio of zinc concentration in the hippocampus, which is a portion of the brain. So they're saying that the conventional antidepressants lead to redistribution of the brain's zinc pool. So maybe we can do away, I'm not of course advocating that, you work with your physician, but maybe eventually in time it will be seen that the safest thing is to increase zinc as opposed to chronic electroconvulsive treatment. So a little bit more here. Several clinical studies have examined blood zinc levels in major depression. So this appears to be the first clinical trial, but that before that, as we were talking about, they just looked at where zinc levels were in depression. As we were saying, you know, from that, when you're not giving it, you don't know exactly what's going on. Is the lower level a reaction, or is it what's causing the problem? And they talk about these references 8 through 10. So 9 was one that we talked about in part 1, and I mentioned that, you know, when you just put in zinc depression, you're going to miss some. So 8 is hypozincanemia in depression. So they got me there. I wouldn't have thought to search on hypozincanemia. Oh well. Maybe we'll bring these up and look at them. What we know is that these aren't clinical trials. They're very useful. They're population-based studies where they're looking at blood levels, and they're seeing that the blood levels, that's what hypozincanemia would mean, low blood levels of zinc, that they see that in depression, but it's not a clinical trial where they're giving zinc. So I may take a quick look at them myself, but probably not talk about them. And then this last one, zinc in depressive disorder. So we didn't catch that one with zinc depression. So it's always good to try to go through things in more detail when you have the full text, because of course the people writing the articles are the experts. Let's move on to more articles, but I think this is a very strong So here's article. One, zinc in the treatment of dysgeusia. That's where you lose your sense of taste. And won't spend much time on this, but just real quick, they gave 140 milligrams a day of zinc. That compares with the 25 milligrams per day they were giving in the previous study. And they had idiopathic dysgeusia. This means they lost their sense of taste, and we have no clue why. And it's a fairly decent sized study, 50 patients, 26 receiving the zinc gluconate, and 24 receiving placebo. I don't want to go off on too many tangents, but you also have to be careful with your placebos. In this case, it's lactose, which is a sugar. So you have to look at those things too. So for instance, if this was a diabetes study, then you're giving the placebo as a sugar pill, then that wouldn't be good. But that's neither here nor there. So they were randomized, and the patients on zinc did much better. Here the p-value is 0.001. And similarly, with the Beck Depression Inventory, that improved with the zinc. The one problem that you would worry about with a study like this is something called a confounding variable. And in this case, did they get better because their sense of taste came back? So in other words, yes, they became less depressed, but that was because they regained their sense of taste, and in the absence of that improvement, this wouldn't have changed. But it is nonetheless supportive. You just worry about these things, and we already have a good study, small one, showing that zinc is helpful in depression. Don't care. Let's get back to the first page. So we're up to 2005, and we've got 20 studies. This is going to take more than 2 parts. Time flies when you're having fun. Here they're looking at it in colds. That's sort of what zinc is known for. Be interesting to find out what they found. Chronic fatigue syndrome, lowered zinc levels, and immune defects. That is platelet superoxide dismutase activity. I don't think that's too relevant. This one is. This seems to be very similar to the one we just reviewed, the pilot study. And even though it says full text links here, it's behind a paywall. So again, I could get the article, but I want this to be stuff that people can all see for themselves and can do for themselves. So we'll just talk about the abstract. Zinc exhibits preclinical antidepressant efficacy. So this is again, placebo-controlled double-blind study, and this was in 60 patients with unipolar depression for major depression. So it's pretty much the same design as the other study, but this time instead of like 15 patients, it's 60. And what did we see? They said there were no significant differences in these measures of depression and treatment between zinc supplemented and placebo supplemented treatment in non-resistant patients. However, zinc supplementation significantly reduced depression scores and facilitated the treatment outcome in antidepressant treatment-resistant patients. So in other words, what they're saying here is that for the patients who got better on antidepressant therapy, they didn't get way better with zinc supplementation. Just as an aside, I mean, how good can you become? Are you bouncing off the walls with joy? But so they're saying that when patients got better, the non-resistant patients, they didn't see a statistically significant improvement when they had zinc. However, for the patients that didn't get better, zinc supplementation significantly reduced the number of patients that didn't get better. And their conclusion, zinc supplementation augments the efficacy and speed of onset of therapeutic response to imipramine treatment, particularly in patients previously non-responsive. So that's it. If they were previously non-responsive, they saw an effect. And again, we have the glutamatergic transmission theory going on there. So that's 2 studies now showing benefits of zinc as an adjuvant treatment in depression. I'm realizing this is going to be like 4 or 5 parts because this is already coming up on 20 minutes, and try and keep it to a half hour. Here was one: micronutrient supplementation may reduce symptoms of depression in Guatemalan women. They didn't see anything specifically with zinc. Why this was a little bit not strong is just because they gave them like 5 different things, and when they gave them the 5 different things, they had some improvement in their depression, but they couldn't tease out anything except for maybe folic acid was helpful. But again, it's not that strong of evidence because you're giving a hodgepodge of things, and so you're not certain whether there are interactions between the things or what's doing what. Here is a somewhat similar one, but this one did at least isolate zinc. This is effects of zinc supplementation on mood states in young women. So in this case, what they did, double-blind randomized placebo, they gave a multivitamin, which you can consider just sort of the standard therapy, or a multivitamin plus 7 milligrams of zinc. So recall in the other study for dysgeusia, I think it was like 125, and the depression study was 25, so this is not much zinc. Daily for 10 weeks. And then they compared the two groups. So women who took the multivitamin and zinc showed a significant reduction in anger hostility score. That's just super. And depression dejection score. And in the profile, and in this profile of mood score. So basically, giving the 7 milligrams of zinc as compared to just a multivitamin, these young women were less hostile, and they were happier, and I'm not familiar with the profile of mood states, but I think that's a good thing that improved. May be effective in reducing anger and depression. Let's drive on. Here's another one that isn't a trial, I believe, where they're giving zinc. Oh no, maybe it is. Just a moment. Okay, this study we should probably talk about for a little while. It's unfortunate the full text is behind a paywall. So this is similar to the previous two studies that were positive. One pilot study that was strongly positive, the other that was positive in treatment-resistant patients, where they're giving zinc in conjunction with a standard antidepressant and seeing what happens. So it's a placebo-controlled double-blind study. 60 patients, major depression. This is 40 females and 20 males, 18 to 55. They also, just to make things spicy, threw in 25 healthy volunteers, and then they would take blood samples for serum zinc at the start, and then at 2, 6, and 12 weeks. So the first thing is they noted that the serum zinc level was lower in depressed patients than in healthy volunteers. So that's similar to the population-based studies that we saw earlier, finding that people with lower zinc levels tend to be depressed. This gets interesting. All groups demonstrated a gradual increase in zinc concentrations over the period of imipramine treatment. So whether they received zinc plus imipramine or just imipramine, the imipramine also led to an increase in zinc concentration, their blood levels of zinc, with or without zinc supplementation. Treatment-resistant patients demonstrated lower levels of zinc, so that if the zinc level wasn't going up, they weren't responding to treatment. Then treatment non-resistant patients, zinc concentrations were higher in zinc supplemented patients than in placebo supplemented patients. So while the imipramine raised zinc levels, if they added zinc, then as you might suspect, the increase in blood levels of zinc was higher. Zinc supplementation increased zinc concentrations over the period of treatment, so they did increase the zinc levels. A significant negative correlation, this is the money quote, I think, a significant negative correlation was demonstrated. They have lots of depression rating scales. Between the Montgomery-Åsberg depression rating scale and the serum zinc level, together with the concomitant increase in serum zinc in patients in remission. So again, if it's a negative correlation, it means the higher the zinc, the lower this depression rating scale went. Serum zinc is a state marker of depression. I may have to pull that article up myself just to, that looks like a really interesting one to read more fully. Alright, can we do one more? Alright, I have to wrap it up here. We'll go in part 3 through the rest of the literature. We'll journey back to Guatemala and more. There's another dysgeusia study, so exciting stuff. But in all seriousness, my goal here is to make the medical literature available to the public in an understandable manner. Please provide feedback. You can tell me, well, you're being too technical, don't know what you're saying here, or you can say, you know, why are you defining every other term? We're not morons, just get on with it. I don't really know. This is new to me to talk through the literature this way, and not much else to say. Oh, if you want to support what I'm doing and you like this, be sure to subscribe to the channel, and you can follow me on Twitter. And until part 3, here's to your health.